Hey patrons, welcome to the Homestead. Quick update, just real quick update. I got to make this quick because I got so much stuff to do, and physical therapy is coming over here at like noon. So, a quick report. We got the pathology report back, and everything came back benign except for 2 lymph nodes. That was really spectacular. All the testing, all the bone, all the marrow, all the other lymph nodes came back negative, no cancer, except for 2 lymph nodes. The doctor said 1 lymph node, they probably wouldn't even recommend radiation. Both the lymph nodes were intact. They took 14 from one side and 6 from the other side. And everything came back negative except for 2, and both the lymph nodes were intact. And it looks clean, so at this point, really, she's cancer-free. However, the doctor said because there was 2 lymph nodes, they're probably going to recommend radiation. Normally, if they just found 1 lymph node, they wouldn't even recommend radiation if it was intact and it looked okay. But they're going to probably recommend radiation. So we're not going to do that. We're going to instead go do the vitamin C IVs. Jamie tomorrow has a small surgery scheduled to put her port in. Should be a quick in and out procedure, easy peasy. But she'll get that port in, and then we can start doing the IVs coming up here on the next week. So my prayer at this point here is we're praying that the doctor, who the surgeon is, who did the surgery for her jaw or her chin removal, is not going to throw too big of a fit, because we're going to tell him probably on Monday that we are not going to be doing the radiation. We're going to instead be doing the IVs. And for vitamin C, there is a clinic in Fayetteville that a lot of doctors are actually sending their patients to, cancer patients to get the vitamin C IVs in lieu of radiation. So this is not something crazy. Other doctors are doing it. So I guess our prayer is that he's not going to throw too big of a fit, because we're going to do that instead of the radiation. So at this point, what we want to do is continue on with our protocol, supplements, things like that. Start doing the IVs now that we're going to be getting our port in, and that in 3 months' time, she will do another PET scan, go back to the surgeon, get the PET scan done, and look for any signs of cancer. But at this point, the way the doctors are looking at it, she is cancer-free, but they want to do radiation because there were 2 lymph nodes that came back positive for squamous cell carcinoma. Everything else was negative. You look down the list that they gave us here, it says benign, 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 benign. Negative, 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 negative. Except for those 2 lymph nodes that they removed from her neck. So anyway, all good news, at least we think. Everything's looking pretty good on that. But again, our prayer is that over the next 3 months, we can do this IV treatment and continue with our supplements, continue to get her blood count numbers up as we're being advised by a doctor who's helping us, and then we'll keep you posted. But the next 3 months are going to be critical to just kind of maintain what we're doing, and again, hoping that our surgeon doesn't totally abandon us because we're going to be doing the IVs. Also, a lot of people are asking about Reconstruction. She doesn't have any teeth in her bottom jaw right now, and they've put a mass of flesh down there to kind of act as gum line. Some of that's going to have to be coming out, so we're going to have to, when it comes to reconstruction, we're going to have to take some of that out, because they always put more than they need. It's always good to have more than not enough. So they're going to have to take some of that out, and then we have to go back and figure out how reconstruction is going to begin, and that's putting in some teeth, either as implants or some sort of dentures or something here, so she can have bottom teeth, and rebuild all that. And I don't know how we're going to do that yet. That's some months down the road. We have to get past our first PET scan, which is in about 3 months' time. Once that comes back negative, then we'll be more in a position to start rebuilding. We will rebuild. Okay. Thanks, patrons. Really appreciate your support and your continued prayers and comments and encouragement you've been giving us during this time. So, all right, guys. See you next time in the Homestead. Bye.